See it okay now? Okay. So thanks for inviting us. I'm really happy to be here. Thanks for that introduction, Joe. So as mentioned, I'm going to talk about housing instability among young children, focusing on children with special health care needs, using data from Children's Health Watch. And I'll talk a little bit more about the specifics of that study as we get into the presentation. And so I will give this initial presentation, but hope to have some discussion and questions afterwards. And Kelly is on hand for all the questions that I can't answer. So the precipitating, I think, factor for this presentation was this paper. This is the paper that Joe mentioned, and we're happy to send this around if it's helpful. This was a recent paper we saw that's related to some of the work that PC and others of you on this call are doing. And what led to this paper is this increasing acknowledgement in the healthcare sector. I know I'm preaching to the choir here, but of the importance of social determinants of health. And this has led to a real increase in screening and interventions in outpatient settings, particularly in pediatric settings, but less so in inpatient. And at the same time, babies and children who are in inpatient settings are actually the ones who might be the most vulnerable to hardships like housing instability, food insecurity that their families are experiencing. And at the same time, the families of these children might be more likely to experience those hardships because of all the time and the cost and the stress related to having a sick or hospitalized child. So for this analysis, what we did is we focused on preterm birth, because babies who are born preterm are more likely to spend time in the NICU, and their families might therefore be more likely to find themselves in this situation. So our goal here was to look at household housing, energy, food, and healthcare hardships in the past year by preterm birth status. And we looked at the first 1,000 days. This is the preconception period, so pregnancy plus the first 2 years of the child's life. And we were using data from 5 different cities around the country. And again, I will on the next slide describe that a little bit more in depth, but I want to just give you an overview of what we were looking at, what we found here first. So overall, what we found is that these household hardships were really common, and they were even more common among families with a child or an infant who had been born preterm. So over 60% of the families of preterm children in our survey experienced at least one of these household hardships, compared to 56% of families with a child born at term. So these hardships were in our sample were really common overall, but even more common among families with a baby born preterm. And actually the strongest associations were between preterm birth and hardships for very young infants who were 0 to 3 years old, and those who were born at 31 to 33 weeks gestation. So our thought there is that, one, it makes sense because these very young infants are those who may have had a most recent NICU stay, but they're not so preterm that they might still be in the NICU, in which case they actually would not have been in our survey because of the way we sample. And also, it's possible that those very, very preterm babies, because or related to these very extended NICU stays, are having more, their families are having more opportunities to get linked with services, whereas babies who are that little bit older when they're born are maybe not, their families are not having quite that same opportunity to connect. So today what we're going to do is drill down a little bit more specifically into the Philadelphia data here. I know that many of you are specifically working with folks in Philadelphia. So, and some of the characteristics and some of the associations are a little bit different in the 5 cities we looked at. So we're going to really focus on Philadelphia here. So all the data come from a study called Children's Health Watch. This is a multi-site study. It's actually been going for a long time. It was founded in 1998. It's in 5 cities around the country. So Philadelphia is one of them, but also Boston, Minneapolis, Baltimore, and Little Rock. And what we do for this study is we conduct surveys of caregivers of infants and toddlers who are under 4 years old, so under 48 months. And these surveys are conducted in the waiting areas of urban hospitals. In some sites, these are EDs, like pediatric EDs, and in some sites, it's pediatric primary care clinics, but primary care clinics in hospital settings. And I'll talk a little bit more about specifically in Philadelphia. It's an ED site in Philadelphia, emergency department. And we do continuous data collection. So, some studies will conduct collect data for a certain period of time and then wait a year or so and then have another round of data collection. Children's Health Watch is a little bit different. We are continuously collecting data. And the reason for that is that it's what's called a sentinel survey. So a sentinel study, because we have nonstop data collection over time, it means that we're really easily able to see trends that happen because of things like, for example, the COVID pandemic, or in particular, we keep a close eye on policy changes and look at how the data are changing as there are different policies that come and go. Surveys are conducted in English or Spanish. In Philadelphia, English or Spanish. We do also conduct surveys in Somali in Minneapolis, because in that particular setting, there are a lot of families who speak Somali. And we share our findings with academics, with legislators, with the public, with groups such as yourselves. So I want to just draw your attention actually for today to a different but related study, because the data I'm going to present today are more closely aligned with this other study that I actually think is even more closely focused in on the work that this group is doing. So this was a study from Children's Health Watch from a few years ago, looking at housing instability. So the one that I described before was looking at housing instability, but also food insecurity, energy insecurity, healthcare, difficulty paying for healthcare. This analysis was looking specifically at housing instability and among families of young children with special healthcare needs. So rather than looking just at preterm birth, looking more broadly at children who have physical, mental, or behavioral health conditions that require some kind of ongoing care above and beyond other children. And so this was another analysis looking at data from all 5 cities, and we found that indeed, families of children with special health care needs were more likely to experience housing instability than families of children without a special health care need. And we looked at a couple different measures. So this finding was true both for families reporting that they had trouble, they were unable to pay their rent or mortgage in the past year, as well as actually experiencing homelessness. So in this study, families of children with special health care needs, and this was using our whole sample, so all up through age 3, had 44% higher odds of experiencing homelessness. What's interesting is in this analysis, we also broke it down by whether or not the child was receiving supplemental security income, or SSI. There's a subset of the children with special health care needs who were receiving that because they had a qualifying disability. And we actually found that these associations between having a special health care need and experiencing housing instability did not hold among families where the child was receiving SSI. So what that said to us is that SSI is an important policy, right, that seems to be protective and keeping the families of children who are receiving SSI, even though they out of housing an unstable housing situation, even though they do have special health care needs. I'll just stop for a minute in case anyone has any questions, or sometimes I'm not sure if I'm being clear, so please do let me know. Yeah, so there's a question in the chat about homelessness during pregnancy and special health care needs. So there is some prior research looking at poor birth outcomes associated with homelessness during pregnancy. In this particular analysis, these set of papers, because of the way we asked the questions in the survey, we weren't able to break it down into housing instability or homelessness experience specifically during pregnancy, as opposed to in that very early infancy period. But because in some of these analyses, like the first one I showed, we looked at a time period that would span pregnancy, but we can't break down just specifically, unfortunately, the experiences during pregnancy versus when the child was born. I'm hoping as numbers continue to increase that that's something we'll be able to do later on. Okay, so for today, oh, here we go. Sorry, I've got like a weird animation that didn't quite work here, so I'm just going to take it away. As I mentioned, we're going to focus on data in Philadelphia, and what I'm going to do is essentially present some stuff that's kind of like what was on the last slide about housing instability and special healthcare needs, but really honing in on Philadelphia instead of just looking across all 5 sites. So in Philadelphia, although the overall study started in 1998, Philadelphia joined in 2005. So we have data going back to 2005, and all the data for the Philadelphia site are collected in the emergency department waiting area of St. Christopher's Hospital for Children. So it's up at St. Chris. So that is one thing to keep in mind. What I'm going to show here is a sample of families surveyed while in the emergency department of St. Chris Hospital. So it's not necessarily representative of the entire city, but is representative of, I'll show you a group of families, most of whom are living with low incomes and most of whom live in the North Philly area, the area around St. Chris. So overall, and this is, I just want to throw it out there that if you have other things you may want to look at, we're happy to, I'll have my contact information at the end, happy to have conversations with you. We do have, since 2005, information from about 15,000 surveys in Philly from up in St. Chris. So we do have a lot of data and a lot of data over time. Now, because different questions, sets of questions have come in and out of the survey over time, because we're focusing on children with special health care needs today, I'm going to be talking about just the subset of those 15,000. So 5848, almost 5,900 families who answered those questions about special health care need. And that's going to be representing the years 2013 through March 2020. You may recognize that March 2020 date. That's when we had to shut down data collection because of the pandemic. We then had just so you know, we had a break. During that time, we conducted a separate COVID specific survey with families, which I'm happy to talk about if people have questions about that, about their experiences during COVID. And we've since started collecting data again, partly, but not in the ED anymore. We're partly in the primary care clinics at St. Chris and partly over phone. So out of this close to 5,900 families that we're talking about today, the median age of the child when the caregiver completed the survey was 18 months, although the range, as you see, goes from 8 months all the way to 31 months. A little over half of, I'm just kind of providing you the context here, of the children are male. 85% of mothers were US born. And remember, this is this North Philly population. So 55% of the kids in this sample I'm talking about today have a Latina mother, 9% a non-Latina white mother, and about a third a non-Latina Black mother. And very, very few, in very few cases did the child have a mother who was of another or of multiple races or ethnicities. There is actually, I'm not talking about it here, but there is also, I'm just responding to a question in the chat. There is existing research looking at parental or specifically prenatal health care and preterm birth, and there have been some links there found in other studies. So just to show you specifically how we're defining special healthcare needs among the children here, it's based on a whole series of survey questions around 5 different types of healthcare needs that children might have. So this is whether the child has a prescription, needs medical care, has functional limitations, requires some kind of special therapy. So this could include physical, occupational, or speech therapy, including early intervention, or requires treatment or counseling. And then for each of these 5 types of need, we asked if this was for some kind of a medical, physical, or behavioral health condition that has lasted or is expected to last 12 months or longer, so at least a year. And a child was defined as having a special health care need if the caregiver reported at least one or more, at least one of these needs, and that was for a condition that had lasted or was expected to last at least a year. No worries, this is a broadly defined topic, so I don't think that was off topic at all. That I'm responding again to the question in the chat. So to summarize this, a child was defined as having special healthcare needs if the caregiver reported at least one of 5 health circumstances that lasted or expected to last 12 months. And overall, about a fifth, 1 in 5 or 21% of the children in this particular sample in the ED of St. Chris did have some kind of a special healthcare need. And then this is a demographics table like I showed you before, but this is specifically among the children who do have a special healthcare need. So overall, that was a little over 1,200 children in our sample. And actually, overall, the demographic characteristics of the children with special healthcare needs are pretty similar to those among the full sample for Children's Health Watch Philadelphia. Now, I know there's been like a focus in the title and a focus here on homelessness specifically. I suppose you could say good news is that relatively few children in our sample experienced homelessness, or at least had their primary caregiver in the survey report that they had experienced homelessness. So overall, in this group of a little over 5,800 children, 170 of them, or 2.9%, had experienced homelessness. Because that is a pretty small number, and also because there is prior research showing that unstable housing in ways not just homelessness, but other forms of unstable housing are also related to poor child development and health outcomes. We're focusing here, or what I'm going to talk about here, is not just homelessness, but more broadly defined housing instability. And I will talk about how we're specifically defining that. I just want to point out this is not just homelessness we're going to be talking about, but also other types of housing instability. So this is how we defined housing instability. A child was considered having experienced housing instability if the caregiver reported any of the following. So one is that in the past year, they were not able to pay rent or mortgage on time, and or that the child had experienced homelessness or lived in a shelter at any time during his or her life, and or the child had experienced frequent moves in the past year, so had lived in more than 2 homes over the past year. So any of the above, and the child was considered to have experienced housing instability, and that housing instability is very common as well in this sample. So overall, 1 in 4 children in this sample of about 5,800 young children had experienced housing instability. So what we were really interested here is looking specifically at children who have special health care needs and are experiencing housing instability. So this gives you an idea of the overlap there. So overall, about 1 in 5 of the children had a special health care need, and about 1 in 4 had experienced housing instability, and 7% of the total sample, or almost 400 kids, both had a special health care need and had experienced housing instability. And overall, we did find that, I mean, it's like we find the same unfortunate thing over and over again, right? Children with special health care needs were more likely to experience housing instability than children who did not. So overall in the sample, 25%, about 1 in 4 experienced housing instability. Among children with special health care needs, that was closer to 1 in 3. And that is a statistically significant difference there. Now, this graph shows kind of the same thing, but it looks like that at the trend over time. So this is the trend from 2013 to early 2020. The dark blue line is the full sample of about 5,800 kids, and the light blue line is those kids who had a special health care need. So, I mean, the good news here is that over time, both lines are going down. So we are seeing overall in our sample, and I'd be interested to hear how this lays on top of or jives with what you have been seeing in your work. But we did see a decrease over time overall in housing instability. But in every year, children with special health care needs, that light blue line, were more likely to experience housing instability than other kids. And that disparity, that gap between the lines, really has not moved at all. And if anything, may have slightly widened over the past, more recently into the like just pre-pandemic period. So what I'm going to do over the next few slides is just break down a little bit more what's going on among these kids with special health care needs who are experiencing housing instability. So what this does is break down housing instability according to the specific health care need. If you remember, we defined a special health care need as any one of these 5 different needs. So this breaks it down by each need. And because some kids might have more than one need, you might see that there might be some children who are represented in more than one bar here. But what you see is that overall, the highest proportion experiencing housing instability was among children who have a condition that requires special treatment or counseling. And then to drill down a little bit more, so this is among children with special health care needs, the percent who have housing instability broken down by their age at the time of survey. And so these are not statistically significant differences. So statistically, these are kind of equivalent percents, but there's some trend that this is a little bit more common among those kids who are in that like 1 to 2 age range at the time of the survey. And this is the same thing, but looking at preterm birth. So this is a little bit different from what we had found in the 5-site study in this particular group of kids. And remember, this is all kids who do have a special health care need, but among those kids, we didn't see a significant difference in housing instability based on whether they were preterm or not. And some of that may be because this is all kids who have special health care needs, right? So it might be that at that point, preterm birth is just one piece of a larger picture. This is looking by survey language. This is actually one of the few differences I'm showing you in these graphs that is statistically significantly different. And I'd be interested to hear your take on what is driving this. But what we found, and again, our numbers do get pretty small, but among kids with special health care needs, those with a caregiver who did the survey in English were more likely to report the child had experienced housing instability than kids whose caregivers did the survey in Spanish. And looking at this a little bit, a kind of a similar, but not the same measure, looking at by maternal race and ethnicity. Here, we actually do not see large differences by maternal race or ethnicity, with the exception of this, and I take this with a grain of salt because we're looking at a very small group now, that there's some indication that maybe among this very small number of kids whose mothers were not Latina, non-Latina white, or non-Latina Black, that they were less likely to experience housing instability. So overall, in this, I feel like I keep needing to bring up this caveat that this is not the entire city of Philadelphia, but among this sample of children, all aged under 4, whose caregivers participated in the survey in the St. Chris Emergency Department, many of the children, about 1 in 5, did have a special health care need. And many of them, about 1 in 4,
I was just thinking I should tell Joe
experienced housing instability, although this did decrease over time. And housing instability was even more common among children with special health care needs. So almost 1 in 3 children with a special health care need had experienced housing instability. So just swinging back to our original goal, right? I think this does corroborate our rationale in doing this set of studies, to start with, about a need for screening and referrals in pediatric inpatient and other specialty settings, as well as the flip side, right, of the need to ensure housing for what is a particularly acutely vulnerable population of kids and their families. And that is all I have. This is my email address, and as well as a link to the website for Children's Health Watch, where you can find more information about the study. And also there's a whole bunch of different papers and policy briefs and blog posts having to do with social determinants of health in young children, including many related specifically to housing, that are on that website. So I'm going to stop sharing there, and would welcome any thoughts you have, any questions you have, any interpretations that you have.
Folks, if it's total silence, feel free to jump in, but if not, if you could use the raise hand function, that would be helpful for us to guide the conversation. On top of my screen, we have Melissa Johnson. Melissa, can you introduce yourself and tell us who you are?
Sure, thanks, Joe. I am the social work trainer for the Homeless Health Initiative at CHOP. And in my role, excuse me, I coordinate and build programming on site in family shelters and now an unaccompanied youth shelter that promotes health and wellness, right? So we have clinics, and then we have other sort of wellness programs for families during their time in shelter. One of the things that was, not in my job description that I'm doing a lot of is advocating for children with special health care needs and housing. Even just getting into shelter. So I guess I want to start by saying PEC is absolutely a leader in this area. So for years, I was able to, you sort of use a back door to get families straight into transitional housing who weren't allowed to live in shelter because of their healthcare needs. And so one of two things would happen. Either the system said, we can't accept you into our shelter system. Sometimes it wasn't actually valid, right? And we were able to kind of advocate for those changes. Or the medical care team is saying, you can't, with this health condition, you cannot be discharged into shelter. So it gets really tricky. PEC has been wonderful in holding a couple of their units for our families who really have nowhere else to go. But I would love to know, how can we, what efforts are you sort of organizing around advocacy, and how can we support that? Or who do we get together? Like, how do we really get this issue in front of people who can make a difference? And I feel like I'm always sort of like bombarding anytime I meet someone from like Medicaid, a provider. I'm like, so would you like to invest in housing so that way you don't have to pay for all of these other healthcare bills down the road? No one has bought what I'm selling yet, but I would just love to work together and really, you know, build some sort of momentum around this particular population, and just I really appreciate the work that you're doing and what you're publishing and spreading. Sorry, that was a lot.
Thank you. No, this is great. And I do agree that, I mean, PEC is such a leader here. I hate to bounce this right back to the group and right back to Joe, but in a way, I actually have a lot of the same questions. Like, I feel that, I mean, Children's Health Watch as an organization is involved in a lot of policy advocacy, but it tends to be more federal policy, because we're really making use of the fact that we have data across multiple sites. So we do a lot of work around federal policy related to food insecurity, for example, and also like we've done a lot around the child tax credit expansion, and then unfortunate de-expansion, and then hope that it would remain expanded, and then it didn't. But I would really love to hear from you guys what, like, I feel like we're producing this data that I would hope would help to make the case you're trying to make. So the more you can tell us, like, what information and presented in what ways would help move this forward. That's really my main goal, I have to say, in being here today, to find that out.
If I could jump in, I would say that related to Melissa's efforts, we used two of our transitional housing programs and we took them offline, meaning they weren't in the homeless housing system, although they paid for the housing. We took a couple of families from CHOP, and they were right next door to my office, so I got to see them almost every day. We are trying to work with two of the Medicaid providers to convert our, we used to have an emergency housing program, so we have actually 80 units of housing that we could accommodate them, but we have to get the Medicaid folks to try to figure out how to pay for that and create a system to not only serve CHOPS kids, but maybe some other kids in other healthcare systems and all. So we're trying to make that happen. Anybody else want to hop in on that question?
Well, if I could jump in, so
Anne-Marie, introduce yourself, please. Anne-Marie, introduce yourself.
Oh, I'm Anne-Marie Collins. I'm the executive director at Druding Center, but we're part of Redeemer Health. And as part of that, I have been participating, and I think CHOPS, and I can't think of the name of it, the group of health systems and hospitals in Philadelphia that get together and do the community needs assessment. And CHOP has been part of that. And one of the things that they're looking at is housing and the connection. And I think now more than ever, there is this understanding from health insurance companies of the need to invest in housing because of social determinants of health. So I don't know how more folks from this group could become part of that, or whether St. Chris's joins, and because I think there's an opportunity and I guess I'm sitting here thinking about, well, if they want to eliminate funding for transitional housing, it's an opportunity for those of us that have worked with really young families to partner with health systems to address these needs. So Joe, I'll follow up with you on conversations with Medicaid, but it would be interesting if we could take a broader approach with insurance companies, not just Medicaid, but other insurance companies to address these needs.
Yeah, I agree. Yeah, let's follow up. We've been talking to Health Partners and Universal and all, so not anywhere near, completing those conversations. Anybody else on this specific topic?
Um,
Aaron? Mhm.
I have certainly seen more interest from health insurance companies in starting to explore those things since the kind of mandate that they be spending more money on social and structural determinants of health. And I think that's a really good angle to present it from. I've also seen some interest in kind of like block grant type of stuff for direct access emergency funds. So that's conversations that I've been engaged with or have read reports on and things like that, where really it's just about getting timely access to concrete support when something happens. A lot of the systems that families try and navigate, especially in perinatal period, postpartum, and pregnancy, there's eviction happens faster than support, or like, a lot, and then there's a lot of families that lose housing, not to legal eviction, but like are kind of pushed out via other means. There's also a lot of youth transitioning to adulthood that are parenting, and we don't have structures for right-sizing families that are already in supported housing, right? And so, too many kids come along, there's not another PHA unit available that can support that. And also, young people don't live. As a parenting mom who lived with my mom when my baby was an infant, I've got to say, well, it's challenging, right? Like, there's a reason that moms want to go and parent, like families want to live with each other. But I think those are some areas that where identifying what special interest groups and then block grant kind of implementation across a variety of needs, like social determinants of health needs, including direct access grants for housing, might be an angle to take versus like strictly housing block grant.
Sarah Shaw, can you introduce yourself?
There, I'm Sarah Shaw. I'm a senior researcher at Chapin Hall and resident of the Philadelphia area. This was really I was very excited to join today's call and hear about your findings. And I think it's great information to be getting out there. I put this in the chat too, but I do, having gone through this very recently with my own family, I do think there's a lot in the discharge process that probably could be looked into. And I think this is some of what Melissa was saying too, around the social work supports and things like that, that families receive as they're exiting the hospital, exiting the NICU, and cycling in and out of that post-NICU time period. There's a lot of supports, and it seems like they kind of trickle off a little bit as children move further past that point in time. So I'd be curious if you all have or thought about kind of longitudinally looking at what happens after children either age out of some of those EI supports or things like that. I don't know if you have that information. I also really think this could be really ripe for some qualitative research to look at what families are experiencing during that transitional point in time, because it is incredibly overwhelming, to say the least. So, but thank you so much for this.
Thanks. Yeah, and that is a great point. I tried to put kind of an abbreviated response in the chat. Unfortunately, we don't have good information on what kinds of supports families were being offered or received around that. Well, I agree that I also have some personal experience with a NICU stay, and but around that really difficult discharge time. We are working on doing some linkage of our survey data with the EHR, the medical records of the kids, which may provide a little insight, but that's another issue where often these kinds of across healthcare systems, right? But depending on the system, the information on services received, diagnoses is pretty standardized, whereas information on these other sorts of referrals can be kind of spotty or difficult to enter in a formalized way. So I'm not sure what we'll be able find. But also would love to talk more. I absolutely agree. I think some really focused qualitative work here, talking with families going through this and what they're experiencing and what they need would really be enormously helpful.
And I will say, sorry, Joe, I'm gonna jump back in here because I could talk about this for days, but I won't. But I just wanted another point. I think just sort of tying this together too is on the CHOP side, part of my role as the social work trainer is to train all of the doctors who come through CHOP. So at each year in their residency, I'm talking to them about, what is family homelessness? What is your role as a pediatrician in supporting families who are experiencing homelessness? So this is really helpful. This research is really helpful in really, we talk a lot about outpatient screen, like, we're talking about primary care and how do you talk to families in primary care? We have all kinds of screenings for them, right? But I think really for me to be able to bring this back to them and say, okay, what are we doing on the inpatient side? What does this look like? And I think, Sarah's point about, and how connected are we staying long-term with these families? I think that's a really important piece for us to add in here. And I also wondering that you had asked about thoughts around Spanish-speaking families' response. And the first thing I thought of was I remember Pew did this study years ago, looking at as government responses and policies were really harsher towards just this really anti-immigration sentiment. All Spanish-speaking people, regardless of their documentation status, felt more stress and more fear around how they would be treated by different systems. And we know that families, and this is part of our work too, is families can be hesitant to share with their medical providers their housing status because of fear of DHS involvement. So I wonder for Spanish-speaking families, again, regardless of immigration status, if there's just a heightened sensitivity to, if I say that we have unstable housing, who is going to get involved? Or even at a smaller level than that, what sort of judgment will I receive from this medical team? And so I just wonder, I like how you presented it when you said, this is what parents reported, because I think that's really important, is how comfortable were families to report that. So there may be more kids out there, there probably are more kids whose parents did not say, yes, we're struggling with housing security right now.
Thanks. That's a really good point. And actually one that has been one of our focuses, looking at that kind of that chilling effect of not wanting to get onto the radar, right? Onto the governmental or the authority radar. It's something we have looked at and have some colleagues specifically looking at in Children's Health Watch. And we have found some of those trends, like some of those kind of drop-offs in what's getting reported among families with an immigrant mother around 2016-ish, 2017. So I think that's a great point. That could be one of the things that's underlying the difference that we're seeing here.
Great. Benjamin, can you introduce yourself?
Yes, good morning. My name is Benjamin Toussaint. I work with CWGEC as a parent educator and parent as teachers. And this last topic that you guys just brought up is really close to home, because I work with a lot of Haitian families. And since as a partner in their lives or in their family activities and daily life, you can say, there are things that they confide in me. And for the past few years, we experienced a wave of people coming from Salvador, Guatemala, Chile, and Brazil. And through the journey, some of them experience sexual abuse, and they enter the country through the border being pregnant. And when they get into the country, they don't give them anything for like how to get to work, or they have no papers, and they are all over Philadelphia. I don't know if that's something that you were aware of, but this is very alarming. And they are homeless. Some of them live in other people's basements. We have some churches in Philadelphia who try to help, but they don't have the financial means to help all these people out. And I work with a lot of them, but the support is not there. And they are like, they want to work, they want to move, they want to go somewhere and find a way to bring food home. And we have some food programs that we direct them to, but they don't have a card to go get the food. And and sometimes when they have to stay in line to get the food, it's not possible. It's very, very difficult for these people. And after like a few months, wherever they lived, they ask them to move out, and now it's gonna get cold pretty soon. So I get to a point where I feel helpless. I feel powerless in front of these people, and I really don't know what to do for them anymore. And I don't know if that's something that if anybody in the panel can share some light or give me some information, or if we can get a one-on-one and to point me in the right direction, that would be very, very helpful. Thank you.
Benjamin, I would love to connect with you at another date to talk about getting some meaningful long-term supports connected with the families you're talking about. The Philadelphia Nurse Family Partnership and Mabel Morris programs do not have any restrictions around serving undocumented children. Many of the other programs that are associated with the Philly families also do not have any restrictions around serving undocumented families. And you can refer either to the call line there. I'm happy to connect with you directly, though, to get you some more support. I think one of the biggest challenges that Philadelphia has in meeting maternal child health home visiting for families where English is not their first language is that we are struggling to get enough providers that speak as many languages as possible. But when you call the CAN hotline that I posted earlier, they do have a running list of who has providers that speak which languages at each program, and may be able to direct towards programs where there's more language proficiency and language line as it doesn't have to be used as often, which I can think increases the trust in those relationships.
Thank you so much. And if language is a barrier, I can provide you with volunteers who would like to help with interpretation as well.
Okay, well, my email is in the link. Shoot me an email and we can set up a time to talk a little further, okay?
All right, thank you so much.
Great. Erin, did you have a question too? Because your hand's up.
Yeah, well, I think Benjamin actually just like outlined beautifully some of the things I was going to say in answer to the question about the differences we see in response rates among people culturally. I think that's a huge reflection on how social determinants of health screenings are written. As somebody who's been delivering screenings to families in home for 13 years, who I know well, who answer questions that are just the opposite of what they're saying, happens very often. And you can, if you're in a slow sitting down and like, oh, okay, you can have time to talk about it. But also the fear of families in honestly answering questions. Philadelphia is making huge strides in improving our child welfare systems. I know that they are working really hard towards it, but the history of our child welfare systems are family policing systems. We still have babies that are getting born to Black and brown people at hospitals being referred directly to DHS for acknowledging their housing security issues. Before they're allowed to leave, they've got DHS in their homes when they're struggling with housing. That should never be a reason for a family to be followed for years in a punitive way. And so I think that that's another thing that's very costly, right? It costs a lot of money to have those types of services when we could be just piling on direct supports right at the front end and treating those needs versus the long-term following of families without necessarily connecting, that like getting all those resources connected sometimes. And then one other point you asked about was that dip in housing, like that there's been an improvement in a decrease in family homelessness. And I think we're going to see a big dip during the period of eviction moratorium, utility moratorium during the pandemic. But I think that dip is going to be matched by a twofold rise that we're going to see within the next 2 to 5 years. And it's we're already seeing it exponentially skyrocket at the front line, but it's not in the data yet. And it's going to be a while. We're going to see it go down further and then back up.
Yeah, I agree. And actually nationally, there's some national work already starting to see that uptick. Yeah, I've been really worried about that. As I mentioned, we did go back and do kind of a related but separate survey with some of the families who had participated in this one about their experiences during COVID. And one thing we did find is that the families were reporting having a lot more trouble paying for basic needs. They'd lost jobs, food insecurity, but we're not reporting more housing instability, which I think, like you're saying, it's the housing moratorium, the eviction diversion program at work. And now that those are sunsetting, it's really scary to look ahead.
Thank you. Marlena, can you introduce yourself?
Hello, hi everybody. Morning. My name is Marlena Smith. I'm actually a program analyst over at the Infant Toddler Early Intervention, Philadelphia County, Department of Behavioral Health, Intellectual Disability Services. It used to be Mental Retardation Services. I just started in the early intervention unit. Before that, I was over on the adult side, and then I started in the early intervention side, then went over to adult and came back. But we basically focus on birth to 3 infant toddlers with developmental delays. And I could put my email address out there, and go back to my supervisor with the questions that I did as far as the data, because that's basically what I'll be working on. I'm just getting information on it. But this form is great, so I've been jotting it down. And Benjamin, I'm gonna put my number in there for you, because what I've seen from this work group is that what you're talking about, housing instability, is not just is broad. It's the families and not, just infant toddlers. From my understanding, it's the whole family. When they have their child, no matter what age, birth to 21, the family's just family homelessness, period. Housing instability, being able to get housing, right? Hello?
Right. Yes, you're asking yes, it's the
Yeah, okay. And
family.
also, it is some resources out there for housing. And it's just basically for us to link to it, because I was in another meeting before this, and it basically was the same thing as far as the profiling part. With what's her name, Miss Aaron? Is that you? Was talking about they automatically, they're afraid for them to be contacted, DHS to be contacted, and that is something that we will have to work on, because this is actually the second time of me hearing this, and this is, I just came into this early intervention unit, so it was good to hear Aaron and Benjamin speak, as well as you, Miss Felice Le'Scherban. I'm sorry if I'm pronouncing it right, but if I'm gonna put my email address out there and send this information over to my supervisor, we'll communicate with her about this, because also it may be some resources and things that we could all collaborate on together, because it looks like we're intertwining with each other. Okay, so I'm gonna put on mute. Okay.
Thanks, Marlena, for that. Yeah, and there's folks in your division that have been coming to these meetings for quite some time, and you guys are an important partner with us. Any other questions? Felice, would you want to talk about, Grace Whitney asked about children in early intervention services.
Yep, so we do actually, I don't have it in front of me, but we do have information on which of the children were receiving early intervention. So I think Grace may be following up about that.
Oh, okay. Mm-hmm.
Yeah.
And as follow-up for here, I will include the paper that Felice is referring to that was published by Children Health Watch. So you have access to that report, which will have that information in there. Anybody else?
I think as advocates, this group is a beautiful group to come together to really also talk with homeless service providers, homeless service supports, to be able to recognize pregnancy and early childhood as a higher risk bracket. There's been many times that I've gone to OHS with families that scored a 1 or 2 on their intake. And by the time, like when I sit with them and make sure they feel safe and secure about talking about every part of what's going on in their lives, they're up at a 13 or 15 and they're going to get services and supports. And I see it over and over again. So I think we as a group need to start looking like at a lot of times not having a child yet doesn't count. Like you don't get the benefits and supports. You can't get preventative services. You can't get connected to some of the, like that baby's gonna get here. Like we need to do that, like help families stabilize during pregnancy as well as in the postpartum period, because once baby's already here, it's a lot harder, right? And I just think that this type of data is so important in creating those arguments when we present it to legislators, when we present it to the city, when we say we need to have specialized services for this specialized population. No one should be getting a DHS call because they don't have a house to go home to with a child with an immunity disorder and can't get into shelter because they just don't have a structure for it, right? Like that's, so I really like this group, and I hope that we can advocate using this data to make some changes to access.
I also want to add that the Division of Maternal, Child, and Family Health of the Philadelphia Department for Public Health has put together in the last 6 months a group of people, a group about 30 to 40 folks, to come together and really talk about early childhood development for all Philadelphia's children ages 0 to 5 and off. And so they finally have a strategic mission, and they're breaking out into some task forces to actually address some key issues. One of which is to how to best communicate to all families with children, young children, and how to increase access to a variety of different health services that would maximize child development and all. We can get that information out to everybody. It's a growing thing. I don't know how successful it might be, but it's an opportunity because, in my opinion, the homeless housing system approaches this work by each individual provider of services. We don't come together as a homeless health system and talk about homeless infants and what their health needs are. We do it as a case agency by agency basis, and maybe we need to coordinate it much better as to develop the system so that each individual actor provider does have the resources that they need to support the families when they do access either emergency or transitional. And the last point on that is that there's been a huge shift in housing resources within the homeless system. As of like 8 years ago, there used to be 600 units of transitional housing. There's now only 150, but they've created a system called the Rapid Rehousing Program, and there are 900 units of this type of housing. And it usually doesn't come with services, but that's still supported by the homeless housing system. And it's something I think a lot of us need to think about on making sure those families in those programs are given support, because they have the same needs as the families in emergency or what used to be transitional housing. We're coming up close to our hour. Yeah, somebody.
Joe, yeah, it's Stephanie Bay from the City of Philadelphia Infant Toddler Early Intervention Program. How are you this morning?
Good, Stephanie. Thanks for joining.
I'm great. So I also invited our intake supervisor, LaShawn Johnson. She's under my name. There was a question regarding the number of referrals and children we're servicing. Marlene, I have LaShawn, the intake supervisor, that can answer that question. Hi, LaShawn.
Hi, good morning, everyone. Okay, so for fiscal year 22, we serviced 105 families. So that was a uptick from fiscal year 21, which was, we're still coming out of COVID at that time. So that was about 49 in that fiscal year. But prior to that, in 19 and 20, there were over 200 families we serviced, but we still know that we're not reaching those numbers that are actually reflected in the community. And so that's one of our initiatives, is to really connect with every partner that we can, so we can service these children from birth to 3. But please let me know if you have any questions.
And Joe, I would also like to add that we finally received our data sharing agreement with the Office of Homeless Services. So we are getting drops of those children that are in the that are receiving support of those children under the age of 3, their location, the parent name, and the child date of birth. So with the Philadelphia Infant and Toddler Early Intervention Program, we have an initiative called Child Find Families Experiencing Homelessness. We make a connection with every site leadership. I don't know if Edie's on the call, but we do have Marlena Smith, who is our new program analyst, that will also be reaching out to the directors of those sites, so we can come out, support the families, and support the staff in order to enroll these children in our services.
Great, Stephanie. Thanks. And let us know if we can help in any way on that. That's a great value add that you have that data licensing agreement. That's awesome. Anybody have any last comments, questions, announcements, proclamations? This has been a heck of a conversation. Felice, thank you very much for sharing this information with us. Looking forward to continue this conversation with you, and as well as others here on the call. I will put some information in the follow-up materials, which will come out next week sometime. So hopefully we can continue this conversation going forward. And Anne-Marie, yeah, let's talk about the medical assistants and how they should be helping our families. Okay. Well, thanks again, everybody. Have a great weekend. Hopefully we'll see you in October for the October, I think it's 12th, Children's Work Group. All right. Take care, everybody. Bye-bye.
Thanks, Joe. Thanks, everyone. Bye.